Aadhaar meets AI inside the government's plan for a health data empire by Sushovan Sarkar. On 15th July, the centre released the blueprint of its plan to set up a health data empire in India. Minister for Health and Family Welfare Dr. Harsh Vardhan unveiled the National Digital Health Blueprint, saying that he was, and I quote, taking an oath to achieve a new dream of a digitized healthcare ecosystem. Among the key principles of the datafication of India's medical ecosystem is a unique health ID for citizens, with Aadhaar as a key identifier. What the blueprint essentially does is lay out the building blocks for the implementation of the National Health Stack, or the NHS, which aims to deploy artificial intelligence in leveraging health records. A 2018 proposal of the Niti Aayog, the NHS has been developed in consultation with iSpert, an organization of private sector volunteers, some of whom have also been involved in building the Aadhaar infrastructure and running operations that leverage it. Acknowledging that medical data exists in silos and without standardization, the government has now set its eyes upon a data-rich trove, the Ayushman Bharat scheme. The blueprint states that the scheme, and I quote, will generate enormous amounts of health data, mostly in the digital space. Keeping true to the government's larger agenda of data as a public good, the blueprint also proposes the linking of multiple databases to generate greater and granular data that can be leveraged by the public as well as the private sector, including insurance companies, hospitals, apps, and researchers. Getting authentic healthcare data is a big challenge, and our data suffers from three basic challenges. I refer to them as the 3 I's: integrity, integration, and intelligence of data, said Professor Rajendra Gupta, former advisor to the Union Health Minister. Professor Rajendra Gupta also says, the Health Ministry must stop printing 3 data reports: National Health Profile, Annual Health Report, and Rural Health Statistics. If you read these 3 reports on the number of, say, hospital beds, you will probably find 3 different data sets on the same topic. Gupta's point about data discrepancy is echoed in the blueprint and National Health Stack. Both emphasize a single source of truth as a major objective and propose the creation of national and regional registries pertaining to doctors, hospitals, pharmacies, and healthcare professionals. The Health Ministry felt that the components of Niti Aayog's ambitious National Health Stack needed to be examined. Therefore, the ministry set up a committee headed by J. Satyanarayana, former chairman of the Aadhaar issuing UIDAI. The National Digital Health Blueprint, submitted to the Ministry on 24th April and placed before the public on 15th July, invites comments and suggestions till 4th August. The policy document essentially lays the implementation plan and defines the building blocks of the NHS. In doing so, it lays down the following objectives. 1. To establish national and regional registries to create single source of truth in respect of clinical establishments, healthcare professionals, health workers, and pharmacies. 2. Creating a system of personal health records, which are accessible to the citizens and to the service providers based on citizen consent. 3. Promoting the adoption of open standards by all the actors in the national digital health ecosystem. 4. Promoting health data analytics and medical research. With ambitious principles of unique IDs, privacy by design, interoperable data, and open standards as core driving principles, the blueprint declares that it seeks to build an ecosystem of integrated databases of patients, health records, and hospitals. Dr. Girdhar Gyani, Director General of Association of Healthcare Providers of India, feels that standardization of data across health sectors is key. During this first stage, the government will be doubly careful about selling. We have been requesting the government for 4 years to standardize health records, he said. This national blueprint illustrates yet another example of the centre moving forward with a major digitization program involving the data of millions of citizens without a data protection law in place. While the government has moved ahead with the sale of vehicle registration data of millions, released a tender for a nationwide facial recognition system, and also passed Aadhaar amendment and the DNA technology bill, it is yet to table the data protection bill. The draft data protection bill was submitted to the Electronics and IT Minister Ravi Shankar Prasad by the B.N. Sri Krishna Committee on 27 July 2018. Data security is a prerequisite for any data movement. Currently, data privacy in health is a grey area, said Dr. Raman Kumar, President of the Academy of Family Physicians of India. Dr. Kumar emphasized that the cost of such sensitive data getting exposed is massive. For example, if the sensitive data is exposed, an insurance company can refuse or hike the premium. Hospitals can refuse someone saying she has multiple morbidity, for example. This requires greater debate on core issues such as data security, data sharing, said Dr. Raman Kumar. Health data is categorized as sensitive personal data and is subject to the most stringent privacy regulations. While the European Union governs it through the General Data Protection Law or GDPR, and the United States has HIPAA or Health Insurance Portability and Accountability Act of 1996 that provides data privacy and security provisions for safeguarding medical information. Data researchers and activists, however, have expressed concerns about the development of this policy, which proposes a health data setup on a foundation of India Stack, which is a bouquet of privately owned proprietary software applications. The health stack was proposed by the lobby group iSpert, said Srinivas Kodali, an independent researcher. National Health Stack is intended to be built atop India Stack, which too has been developed with iSpert as pro bono partners. India Stack is a set of APIs that allows governments, businesses, startups, and developers to utilize the Aadhaar infrastructure for businesses like eKYC and UPI digital payments. Srinivas Kodali added, in fact, it was found that Niti Aayog was emailing all consultation documents to iSpert while they did not place them in the public domain. The blueprint appears to give more legitimacy to stacks, which have been under criticism. The Quint has accessed copies of the email exchanges between Niti Aayog and iSpert officials. So, where is it headed? The blueprint proposes a national digital health mission as a purely government organization with complete functional autonomy, adopting some features of some of the existing national information utilities like UIDAI and GSTN. Among the primary outcomes of this mission from the citizens' perspective is enabling ease of accessing her medical records. All citizens should be able to access the electronic health records, preferably within 5 clicks. 2. Citizens need to undergo any diagnostic test only once during the course of an episode, despite taking treatment from different health service providers. 3. Integrated health services at a single point, though multiple agencies, department service providers are involved. 4. National Digital Health Mission shall assure continuum of care to the citizens across primary, secondary, and tertiary care and across public and private service providers. Experts, however, emphasize on the need to accurately collect and digitize data at the grassroots levels. Currently, we are at 0, and digitization must start at the OPD level. We won't be able to identify meaningful patterns unless we have data for at least 3 years, said Dr. Gyani. Currently, most data is captured at the highest tertiary care level, most of which is fully diagnosed. Data from only tertiary levels will be misleading, said Dr. Raman Kumar.